so you guys have something. To look off of. But hello, everybody. My name is Vivian Kwok. I am a second-year student in the Department of Health Policy and Management, but I'm focused mostly on the health policy track. And so I'm a second year, so I will be graduating or finishing my graduate studies after this quarter. And my next step is I have a health policy fellowship. And if you guys have any questions on that, feel free to send your questions in after or even now if you guys have questions. I didn't take a growth year in between my undergrads and starting graduate school. So I did graduate in 2018, just before starting graduate school. I went to Baylor University, and if you guys don't know where that is, it's in Waco, Texas. If you guys ever heard of Chip and Joanna Gaines, I don't know. They sort of made our town, I guess, tourist town, which was kind of weird to experience. And then another fun fact about Baylor is we also have bears as our mascot. But they actually live on campus, so it was really nice in between classes sometimes to just kind of stop by where they live, see them sleeping, lounging, playing, so that was always really fun. My major was medical humanities, and so what that is, or to kind of explain it a little bit more, it was definitely the more humanities research side of public health. So some of my classes included community health sciences, health education, health communication, global health, medical anthropology. I liked a lot of that stuff, medical ethics. I also minored in journalism, so that's where I connected a lot of my interest in health communications. And I was also involved in both bench research and more like social research, stuff like that. So if you guys had questions about that, feel free to send. And then why HPM at UCLA and why health policy? So throughout my, studies, learning about like health disparities, systemic inequities, social determinants of health, a lot of that stuff, I did recognize health policy as a strong way to address or ameliorate a lot of these issues. So that's why I did want to get into health policy. And it's really where I personally connected as well. So if you guys have questions about that, feel free to send. Why HPM at UCLA in particular? Not to kind of delve into a lot of details, there were just like a handful of different reasons, and I can also kind of explain that if you guys had further questions, but it was a mix of both personal, logistical, things like that. So I guess some logistical reasons is funding definitely helps kind of help you decide which school you're going to go to. And then also just if there was a state that I could study public health in, California is a state that really makes public health a priority and really sees the importance of public health. So there is a lot of opportunities within the state of California to kind of really delve into this field and have a lot of opportunities. But I'll stop there for now so my other colleagues can have a chance to introduce themselves as well.
Lorraine, would you mind continuing?
Sure. Let me go ahead and share my screen. Okay. Are you guys able to see this? Great. Hi, everyone. My name is Lorraine Francisco, and I'm similar to Vivian. I'm also a second-year Master of Public Health student in the Health Policy and Management Department over at the Fielding School here at UCLA. We just kind of wanted to emphasize that Vivian is actually on the policy track and I'm on the management track. And so I did my undergrad in healthcare administration and policy as well from the University of Nevada, Las Vegas. So I am from Las Vegas. And then after undergrad, I graduated early 2016. I did a 2-year fellowship with the CDC. I was a public health advisory field worker stationed in Phoenix, Arizona. And there I did a lot of epidemiological research and kind of managing the program of the consortium there with the health department over at the county level. Let's see. Oops. So I just kind of have more information about what health management is here, just to kind of distinguish that from health policy. Essentially, it aims to advance effectiveness, efficiency, and equity of health services, both on the personal population health. A lot of times we call it as looking at the behind the scenes in healthcare. And healthcare managers work in different settings like hospitals, clinics, health departments, and a lot of different areas. Some things that healthcare managers do is they ensure efficiency of healthcare delivery kind of like on a day-to-day basis. So I mentioned some of us work like in a hospital setting. So that's basically we have, our clinicians, our nurses and doctors kind of ensuring like those things are running smoothly. We also look at identifying the strategic direction of healthcare systems. So an example I can think of is, for example, let's say we've got a group of community clinics and they are looking to expanding. Kind of like what are some of the decisions behind that, or some of the different considerations to make that decision. And of course, we also look at the financial health of organization, making sure that, places are fiscally healthy. And so these are just kind of some of the examples to kind of conceptualize what we do in the field. I also wanted to share that there are different educational avenues to be a healthcare manager. The one I'm doing personally is this Master of Public Health route, the MPH route. But other people also choose to go through different routes, such as the MHA degree, Master of Health Administration, as well as Master of Business Administration, or MBA. Kind of the reason why I chose an MPH was, I mentioned in my undergrad, I also basically studied the same thing, healthcare administration and policy. I didn't really have a lot of public health exposure in my undergrad, and so it wasn't until later when I started participating in different internships that I got to know kind of what healthcare management looks like from a more of a public health lens. And so for me, that looked like looking at really these like systemic barriers for populations to like have equitable access to health. And so that to me kind of like that having that mission and vision behind it was really important. And so that's kind of why I decided to go pursue the health management track with the MPH route, because the MPH, the public health really kind of puts together all of these like different root causes as to why people are even experiencing these different health conditions and outcomes. Yeah, I think that was mine. And if you guys have any other questions about kind of like my career trajectory and my fellowship with the CDC, I'd be happy to talk about that later as well.
Rawa, you're next.
I think it might be under review, Rava.
Rava, unmute yourself. Thank you.
Thank you. So hi everyone, my name is Rahwa. I am a second year graduating MPH student in the emphasis of community health sciences. So overall, the community health science program focuses more on like the health disparities in underserved populations and prepares students who are interested in working more in the field as far as like developing program interventions to ideally like close the gap on certain health problems, emerging public health issues such as like food insecurity or maternal mortality in different populations. So I went to SDSU undergrad. I'm born and raised in San Diego. I did do my undergrad in public health. I knew I really liked the work, but I wasn't sure enough about what I wanted to do after. So I did do a gap year or a growth year. And so I graduated in 2017. And the last year of my undergrad, I started working with AmeriCorps, which is a federally funded organization that focuses more on like service, and you're assigned to an organization of your choosing that you want to work with. So I worked with UC San Diego Center for Community Health and worked really closely with refugee communities that actually identify with some. I grew up in that community as well, so it was really rewarding experience, like being able to see those interventions be implemented and learning how to evaluate them. But I felt like I would learn better if I like step back and learn it structurally, like in a course setting. So that's why I wanted to pursue my master's, and now I feel like I'm more confident in that skill set. And then now things kind of changed not too drastically, but now I realize I wanted to go more on the clinical side. So I've decided to pursue more school after this. So I will be going to physician assistant school starting this summer. So yeah, thank you.
Thank you. And now it's Fan's turn.
Yeah. So let me share my screen. So I'm Fan. I'm the second year Master of Science student in Epidemiology. So why did I choose public health from the beginning? Actually, I came with a background in medicine, but then I figured I'm more interested in studying health problems in a population basis instead of from the hospital or clinical environment. And then, as we can see today, there are many different areas in public health. And for me, I'm more interested in the data analysis, in which we have data, population level data, whether from the hospital or pharmaceutical companies. And then we analyze this data deeply to try to explore the risk factors of different health problems. And my interested areas include epidemiological and causal inference method and evidence synthesis and integration, especially in the chronic disease. Yeah, and if you guys have more questions about career options in epidemiology, feel free to raise your hand to ask questions.
Thank you, Fan. And now it's Sarah's turn. Go ahead, Sarah.
Yep. Hello, I am Sarah. I am a second year public health student in the field of environmental health science, and I'm getting my MS. So in undergraduate, I went to UC Santa Barbara. I was born, raised in SoCal, and so Santa Barbara was a little more central, but still in California. I got my major in environmental studies, and I took a little bit more of a science track. So I focused on introducing myself to toxicology, getting practice within ecology, conservation, and restoration. And I got a minor in theater, which was fantastic for learning how to present, getting out of the science bubble and really getting into group work. And I think it really helped shape me going into EHS. So the reason I went into EHS is because after undergrad, environmental studies is a very large field and can be kind of intimidating when you're graduating from it. So I had a conversation and realized what I want to do is focus on the human side of environmental, which turned out to be environmental health. I had not previously heard of public health until I actually went to graduate school. And so it was a huge learning experience for me discovering this entire new field that I only had just learned existed. So it's the reason I'm interested in it, and what it does is it helps determine what people are exposed to, how that can result in good or bad health effects, and how to encourage the good effects and make sure the bad effects don't happen. And like anything in the environmental field, it stays very broad. You can become a toxicologist and focus on a single chemical for your entire career, or you can do what I'm tending to go to, which is go into project management, project assistance. So that tends to be a little bit more in environmental consulting, environmental analysis. It pulls together the themes that I got from theater, where it's a lot more focused on group work, a lot more out in the field. It also tends to be a lot more varied, that you might have one project focusing on the air quality next to a highway when there's an apartment building there, or something in the desert that has a solar panel project that is going in. So if you're curious about the environmental field or life sciences or what other paths there are than environmental health science, I can answer your questions.
Thank you for your introductions. And now to get to know our audience a little bit better, I built in a couple of polls. So let's launch the first one. So the question is academic standing. So please indicate how far along are you in your academics. Let's see if we can hit 100% participation. We are at 93. Come on, 96. Don't hold out. Only one person. All right. So the poll shows that we have mostly juniors and seniors. And then we have some freshmen and sophomores. Awesome. So here are the poll results. So you guys can have a little bit better idea of what our audience may look like. Okay, and let's see. And here is the second one. Are you planning to apply to an MPH program in the near future? Wow. Okay. A couple of more seconds. Okay, share results. So many of you, yes. Some of you, freshmen and sophomore, probably still exploring public health as a career option. Great. So hopefully you have some great questions for our panelists. There is one question in the Q&A for Rava. Can you talk a little bit more about why you decided to pursue PA after an MPH and their differences?
Yeah, so when I went to SDSU for undergrad, I started as pre-nursing because I knew I wanted to do healthcare. But then I worked in a nursing home, and then I think just hearing all of the patients talk a lot about things they wish they had done really resonated with me and like made me think more, okay, I think I want to go more on the preventative side. So that's why I changed to public health. And then right before UCLA, I worked in nursing homes again, and then, oh, I miss bedside care. But but I'm already going to UCLA, like maybe at that time I thought they were very different. But then my HPM course, actually, we had a lecture on what primary care really was and how very much public health is integrated into it. So that made me it just seemed more possible to do both work. And then I did my field studies, which were all required to do the summer after first year. I did go to a clinic where I saw the health providers and the health educators work very closely together to do a lot of preventative work in addition to all the work with the patients. So, I mean, they're different in the sense in like, you know, one being strictly more preventative, and I guess the other one is more maybe not preventative is the right word, but more individual and like population health, I feel like is the biggest difference. So you can see a lot of them, but yeah, I guess it's just more like which route you decide to go. But that's just what ended up happening for me, and happens to some other students too.
Thank you for that answer. The next question is a little bit more general. How would you recommend looking for various internship opportunities? What advice would you have for applying to them? Anyone who has any suggestions, feel free to jump in.
I can go first. I didn't do internships, but I did do lab work. And I think one of the biggest things, and you've probably heard this repeated over and over again if you've been to career panels, is networking. For me, what helped me was getting to know my professors once I hit upper divisions. So a really key difference I did in my undergrad is I started taking upper divisions my second year and putting up the prep work for some of my major until my third year. And that resulted in me getting to know professors a little earlier on, and it got me into a couple labs where I was able to get that lab experience. And that was my substitute for internships.
Yeah, just following off that, I wouldn't necessarily limit your extracurricular activities and opportunities to just internships, because I would also consider things like volunteering valuable, research valuable, lab experience valuable, and then research that isn't necessarily in a lab, because I did do both lab work and then like the research that you don't do in a lab. So I did both of those, and I would say all my experiences were valuable to kind of giving me exposure to what I'm interested in, and then to also just like you don't know what you don't know, I guess. So also kind of like gives you more insight into career opportunities, jobs that you can do, other topics and stuff like that. So I wouldn't necessarily limit your kind of I guess search to just internships. But to kind of answer your question on how to look for internships, so I guess the first one would be, networking is always a good thing. So if there's something internally within your school or within your professor, that's one way you can approach finding an internship or connections that they may have. Another one is, you can literally just Google different internship opportunities and see what comes up. Something I do want to kind of, I guess, direct you guys to is the CDC page. So Lorraine did do an internship at the CDC. She'd probably talk more about that, but there are a lot of different ways that you can, I guess, land an internship. It can be a larger one, like on the CDC level, or it can also be just as valuable whenever it's like internally in a school or things like that. But yeah, if anybody else has recommendations as well.
I would probably add, even if there's an organization specific, like that you really want to work with, maybe just reaching out to them if they're willing. If they might not post something, but if you're willing to offer work for them, that could be another way to work closely with them.
All right, so let's look at the next question. Thank you for your time. Do any of the panelists have insight on the benefits, drawbacks of taking a gap year between undergrad and starting your MPH program?
Yeah, I can start off our conversation with that. So for me personally, I actually ended up taking 2.5 years after undergrad. I'll tell you that when I was in your shoes as an undergrad, it was something that I never thought I would do. I was one of those people that was like, oh, if I start working or doing something else after undergrad, I'm never going to go back. And so I was definitely very hesitant to do that. But I was, so actually in my senior year of college, I did apply to grad schools. But then another opportunity came around after that, like after I graduated, which was actually that 2-year job at the CDC. And so that's what I was like, you know what, this is more of a unique opportunity. And so I think it's good that I go this route. And I mean, I will say that was really terrifying because I definitely took a risk, right? Because I was like, okay, Lorraine, if you take this job, like there's no guarantee that you're going to have the time or the energy or the motivation, whatever the case may be, to want to go back to grad school after. So now looking back 4 years later, I will say that was definitely one of the best decisions I've made for myself. I think when I was like younger and, in undergrad, I was so focused on like, okay, gotta finish my bachelor's and then do grad school, whatever field, that's in, and just kind of like getting to that finish line, whatever that looks like for you. But then when I was working and I didn't go to grad school right away, I had a lot of growth, I would say, that I didn't think I would have. So for example, The 2-year job I did with the CDC is more like I was hired at the federal level doing public health, but I was stationed in a county level. And so through that role, I really got to know kind of like the structures on the government, like on the government side of what public health is like and kind of like how we implement things, right? I mean, as we all know, that's become very relevant today in today's world. And so that was like the growth that I didn't think I would have had if I had just gone straight to grad school. More on like the personal side, I think I got to really know what area of public health I wanted to go into. And so as you heard from all of us panelists, we're, coming from different areas of public health. Just to let you guys know, if you're not sure yet, whenever you apply to public health programs, there's usually 4 or 5 different areas. And that's kind of like, I think 4 of us are represented here today. The 5th one is biostatistics. But during my growth or gap years, I was kind of able to really hone in on, okay, I am more assured that health management and policy is kind of the track that I want to go into, go into my public health degree. And so, I mean, I could go on and on about like advocating for why growth years are really good. And again, when I was maybe you guys' age, it was something that I didn't really understand. I think it was just nobody really told me or talked to me through like what those options could look like and kind of like what some of those benefits would be.
I think I've also observed there's definitely a distinct difference from people who went straight on, like Vivian and myself, to people who did take those growth years. Some of the benefits of going straight on is that you're still used to the college life, that you are used to strange hours, having to maybe pull really intense hours, knowing how to navigate a college environment is really helpful. And people who have taken multiple years off, there's usually a readjustment to that pace and also a readjustment to having to study, having to do homework, that I've noticed that a struggle. Something that's a downside is that a lot of people who go straight on don't know exactly what they want to do. They know, oh, I want to go into this field and I'd like to do something related to this. But if asked, hey, what job specifically, like give me a job title, you're not necessarily going to have an answer to that. And that's something that a growth year can provide. That the students I've noticed who have taken growth years have a lot more of a focus in their intent of what they're going to do after they graduate with their master's. And that can be beneficial when you're starting to build up networks for getting a career after graduation.
Yeah, and just to speak a little bit more onto kind of like, I guess, pros and cons of both situations that I've noticed and experienced myself is, in addition to what Sarah said, that, I guess we are kind of like used to like, being in school and stuff. It is also nice that, like, I guess one perk of going straight on is also there are less, I guess, life responsibilities, if I could put it that way, because sometimes I do have some classmates and stuff who may be mothers and fathers. So there's other, responsibilities that they have in addition to school, but, going on right after from undergrad, a little bit more likely you don't have as many of those kind of like life responsibilities, I guess. During the situation, it's a little bit, it's different, it's a little bit more challenging. But in general, I guess that is, in kind of like one perk is to just like, continue on that sequence. From undergrad to grad, you still are maintaining a lot of the same, I guess, like skills and generally like phase of life. One drawback, I guess, and Lorraine and Sarah have both touched on this as well, is yes, the network is part of it, and those professional skills that you would have gained if you did take a year or two off from school. So, and Lorraine mentioned this during her introduction, or maybe it was Rafa, but basically we all have an internship that is part of our field studies, part of our program. And so it wasn't actually a challenge whenever I went through it, but it was something that I would think about a lot whenever I was applying for internships and going through the internship search processes. I would think a lot like, oh, I'm maybe not as desirable of a candidate because I don't have these professional skills solidified that a lot of my colleagues who did have a job before this have. And that can kind of play out differently for different applicants and stuff like that, but that was something I did think about. Is like, yeah, like if I did end up doing more of a project management, health administration internship, and so I didn't come in with those skills. And for me, my preceptor understood that. She's like, you're going to be learning these skills in your internship. That's why you have an internship. But I can't speak for every, internship. There may be some internships that do require a higher level of skill and expertise that they require before you go in. So those, just to speak a little bit more on the pros and cons there.
Thank you so much. So let's see. Are there people in your cohorts who did not major in health or STEM-related fields in undergrad? I am a sociology major who would like to pursue health policy, but I'm concerned that my major might not be as applicable.
Yeah, I guess I can start off that. Yes, we have a lot of students who come from a majority of different backgrounds. Just even in our health policy and management department, we had somebody who did banking before this. So there is a lot of, pull from different fields. And I would actually say sociology is a great major to kind of transition into public health. There's a lot of the same themes and things that we study from sociology to public health. But yeah, if anybody else wants to join in as well.
Anyone has any additional?
I would just maybe add, just to add on to some of the things that Vivian said. I think this is more specific to public health. As you all have heard all of us talk about, public health is a very interdisciplinary field. And so really, at least for a lot of different cohorts I've seen, is that they don't look for a specific profile of a person that they want to be a public health practitioner. And so because it's all these fields collaborating together, to really, do these things, whether it's, community health sciences or epidemiology or management, whatever the case may be. And so I think not being from a STEM related or health related field is actually, it's not necessarily to your disadvantage if you're looking to public health programs. I think as long as you're able to kind of articulate why you want to be in a public health school and kind of how you plan to use your background in whatever field you're in, for you, I think you said sociology. As long as you're able to kind of having a narrative along to go with that and then talk about how you plan to use those skills moving forward, I think that helps you stand out for sure.
Thank you.
I also wanted to add just one more thing because I thought of it. Something to also think about is for an MPH, as a Master's of Public Health, it's a professional degree. So what that kind of means is that you are going to be gaining the professional skills that are needed for you to do your job, right? So in undergrad, a lot of the times we aren't taught necessarily the professional skills. We're taught more of the academic side. So whenever you get your MPH, you're going to kind of gain those skills to do your job, I guess. So that's kind of what a professional degree is.
Thank you. Next question. What are certain keywords, job position that we should look for in job descriptions to explore public health positions?
I don't know if there's any specific terms. I think one of the best way to figure out which terms to search for you personally is to talk to alumni who graduated in the field that you are most interested in. So for example, one of the ways that I came across the term project manager for what I wanted to do as a career was by getting into contact with an alumni who had gone through my program previously and talking with her about what she does as a career. And I specifically asked her the question, what does someone search for when they're looking for a career like yours? And that helps narrow it down from public health, which is a very broad field.
Thank you. Next question. For the person who did AmeriCorps, did you find the experience worthwhile? Do you have recommendation for deciding what organizations to work with?
Yeah, I felt like my AmeriCorps experience was what led me to solidify my decision to do MPH, mostly because of the setting I was in. The people around me in the similar positions I wanted to do at the time, like program manager, program director, they were all MPH students, or MPH, they all got their MPH. And it gave me a lot of, I did a lot of shadowing as well, in addition to the work that I did. And it was really nice just being that close to people that I wanted to, I aspired to be like. As far as what organizations, AmeriCorps allows you to work with various different groups, such as nonprofits, like what I worked with through UC San Diego, faith-based organizations. If you want to work through help with affordable housing, teaching, tutoring kids on tech computer skills, cleaning parks. There's just a lot of different service opportunities. I will say it does not pay well, but I feel like, just being really honest, but I just felt like I wouldn't have gotten that much hands-on experience, I don't think, had I done another kind of opportunity with the population that I wanted to serve. So, and then you also get a stipend at the end that helps you with school for loans. So, yeah, so.
Thank you. Next question. Is there opportunities for undergraduates to get involved with the UCLA Fielding School, especially with everything being done remotely?
I'm not too sure about the opportunities that the Fielding School has in general for undergrads, but I do know that you are able to enroll in some of our classes that we take. So if you're interested in exploring kind of like public health, then I would, those would be good classes to check out. I believe that they would be kind of like the upper, I think it's like the 100 series, so it would count as an upper division units for you guys. But those are kind of like some of our core classes that we have.
If you check the Q&A box, one of the questions that has been answered and typed has a link to the public health minor, and you can look and see the classes that the minor consists of there.
Okay, next question. Let's see. Okay. This is for Fan. What did you study as an undergrad? How much biology, chemistry do you need for disease epidemiology? And how often do you use math modeling and statistical modeling?
Oh, so thank you for the question. And I'm actually from China, where the curriculum is kind of different. So I came with a medicine background. But in general, in the epidemiology, it doesn't demand you to know exactly what the mechanism of the disease. The level you need to know is basically that smoking can cause lung cancer, this kind of basic level knowledge. And on the other hand, epidemiology is more about data science in public health. It's in comparison with the biostats, which is more theoretical math modeling. Epidemiology is more about the application of all this modeling. So you don't have to know the assumptions or how they build that model. All you need to know is how to apply them. Yeah.
All right, next question. Can any of the panelists touch on financial aid for grad school and what the work-life balance is like in grad school? Thank you.
I just typed in answers to the financial aid, so I'll go ahead and just say what I typed. Financial aid differs for each graduate school, and for the graduate schools at least I was accepted to, every single one was different. And so what I would strongly recommend is once you're accepted, they're going to have like an admitted students day, panel, weekend, what have you. Attend that, because that's where you're going to get that financial aid. You're not necessarily going to be able to find it on the website, especially for schools where they only offer loans, because there are schools where there was a school I went to where their measure of financial aid was take on $300,000 worth of loans, work in government, and then get the loan remission from working in government. And that was one of the situations where I was like, okay, so then maybe it's not the best school for me. I wouldn't have known unless I went to that admitted students. I imagine someone else can talk about work-life balance.
I can also speak a little bit more on financial aid. So I would also say for like part of your application, you're going to have your personal statement, right? I would say also put a lot of thought into that, because sometimes schools will screen for financial aid and scholarship and award opportunities off your personal statement. And then I would also say that generally after I attended, I got more financial aid as I kind of studied on. So I would say my first year was a little bit more expensive than my second year. Yeah, I just got more money kind of studying on. And so those can kind of come in the form of like departmental scholarships, other schools, continuing student scholarships as well. And then also we're all college academic mentors within the college academic counseling unit. That is also a fee remission position. So some schools will have opportunities like that. Not every school will have opportunities for students to kind of get these fee remission positions. So that's something else I would look into. So it's not necessarily like, did this school offer me, you know, more money or not? Like that's part of it, but what are the other opportunities after you are accepted into the school and going to the school? What other opportunities are there for funding?
Yeah, make sure you sign on those listservs for fellowships, and making sure you're reading all the newsletters, because they can be in there as well, because they're not always as like you unfortunately might have to do extra like digging for funding, but you can potentially get a full ride if you search really, really hard.
Yeah, but yeah, in general, it's because since this is like a graduate degree and it's generally going to make you back money, there is a little bit less opportunities for scholarships, I would say, compared to undergrad. But for the second part of your question, did somebody else also wanted to kind of touch on that?
Sure, I can touch on that a little bit. I think it was the work-life balance. So maybe for you all, something to think about when you're looking into graduate programs. I will say that it kind of varies the amount of flexibility that each graduate program has, whether you're able to work comfortably on top of doing your schoolwork as well. If you think that it's important for you to still be working like a part-time job and also being in school, then definitely when looking into grad schools, whether that's you talking to like students that are currently in that program or you go into admitted student state, I would bring up that question of like, how feasible is it to have this other part-time job? I say that because specifically with my cohort here at UCLA with the health policy and management, it would have been very difficult to have a part-time job during the first year. But that's because the program specifically structures the curriculum so that first year is more of like our work intensive load where classes are. And so a lot of like the building blocks of what we're going to be using for our degree are built into that first year, which means it's a lot more you're taking your classes, but you're also doing a lot of things like going to networking events or doing a lot of group projects, which could literally take hours. However, the second year is then structured so that we have a lot more flexibility to then take on a job while also being on campus. And so, yeah, I think for you guys, something to think about is that if you think that working part-time is, or a full-time job is an important consideration for you, to make sure you look into that when looking to different grad schools that you're applying to.
Thank you. Next question. How happy are you with the fielding school? If you could go back in time, would you choose UCLA again, or would you pick a different school?
So I can go first. Actually, different graduate schools have different program requirements. So for epidemiology in UCLA, what distinguishes from other schools like Yale or Harvard is that it's more theory-based. So if you are more interested in methodological side, you can UCLA is a good option.
I definitely agree with Fan. She mentioned that the UCLA EPI program is more like theory-based. To me, on the contrary, the health policy management track is definitely a lot more practice compared to different programs like UC Berkeley and their MPH program, specifically the health management track. When I was looking into it, I saw that it's more research based, and so. But for me going into it, I knew that I wanted to learn more about the practice of public health and like healthcare management, as opposed to kind of like learning the research with it. And so I think that definitely it involves you kind of like knowing more about what you want to do, and if you don't, that's also okay. I think I can personally say that I've been really happy with my decision to go to UCLA fielding. I think it's the best decision I could have made because of a variety of factors. As you guys, I feel like the graduate school experience is a lot different from the undergrad, because with grad school, it's like you're looking really at like a holistic thing, right? There's one thing to look at the curriculum and make sure it's a good fit for you and your interests, but you also have to look at funding, location. I think some of my panelists have said earlier, when you're older and you're going to grad school, sometimes there's different priorities as opposed to maybe like 4+ years earlier when you were just picking somewhere to go for your undergrad. And so I definitely think it goes back to kind of like your personal preferences, and like kind of like where you see yourself living and all of that.
Yeah, so I would say like just going off of that, choosing a graduate program, it requires a little bit more thought in different areas. So really do spend some time looking into the program that you would like to possibly attend or possibly apply to. So think about like if you're more interested in a certain type of work or a certain type of research, look at the professors and faculty. What are they involved in at that particular school and program? Other kind of yeah, and then for graduate school, it is a little bit more practical sometimes. So some things that I would say probably prioritize is I think one thing that like I didn't think of whenever I was an undergrad, that because I didn't choose necessarily my undergrad based off this, is for graduate school, definitely look at like their network. And then so like potential employers, alumni, stuff like that. And then also look at the job market kind of directly around the school. So for example, for like health policy and management, for like health management, LA is a great area. The health policy management has a great kind of network in the health management field because LA is a great market for that. So those are some things I would kind of keep in mind whenever you're choosing a school.
Thank you for that. You touched upon a couple of questions that are coming up, but there is one that you might be, some of you might be able to answer. What are some of the career possibilities following an MPH concentration in policy?
Yeah, so I can answer that. So basically there's a lot of different roles, I guess. So as we like a major theme that's kind of gone on through this panel is how interdisciplinary public health is. So you can have a career in health policy on a variety of different levels with that. So it can be at the federal level, so working closer to the Capitol, DC, kind of like more federal-based policy work. One of my professors, he did work on one of the administrations, so he was involved in health policy in that way as kind of a staff advisor kind of. You can also work on it at like the state level. So like, again, California has a lot of initiatives going on. And then you can also get involved in health policy at the local level. So for example, maybe the county level, like Los Angeles. You can even go be involved in health policy at an organizational level. So whether it's, for example, for like hospital administration, it does lean a little bit more closer to the health management side, but there is also a role for health policy, in that there are a lot of different policies and laws and practices that are always changing and updating. So there is kind of a place for a person who has a health policy background involved in that. So some kind of like direct maybe job titles, if I can, that kind of stem from that. There's always advocacy. There's kind of sometimes some more like lobbyist positions as well. There's also, I'm also really interested in data analysts or data analysis. So within every kind of field and track, you're always going to have data to analyze and to kind of go off of and be integrated into your work. So there is a lot of work in data analysis for health policy. One of my classes, part of my track, was a policy analysis course. It's pretty core into any health policy role that you are going to be involved in. There can also be, I do find a lot in my studies that community health and health policy do intersect a lot. because there's a lot of things that smaller organizations and on the community level that they have to navigate. And so sometimes being involved in health policy, you tend to have more of like an advocacy background. And so there's things like that that you can get involved in. Immediately after graduation, I'm doing a health policy fellowship. And it's particularly with a legal firm on the legal side. So that's another illustration of kind of how this work can be interdisciplinary. Another thing I do want to highlight is that health policy can be very, again, integrated with different types of work. So Rafa is going on to being a PA in pursuing PA school, but she's still going to carry a lot of the things that she learned and a lot of her passions through community health sciences with her. I find the same thing for health policy. A lot of my mentors are clinical leaders as well. So they have kind of like the nurse practitioner, PA background, or even medical background, but they go on to do health policy work instead of clinical work. So there's like a lot of different things that you can do with health policy.
Thank you so much. So there are a few questions in the Q&A which we won't get to because we are almost out of time. But in the chat box, we provided the contact information. Since, as we mentioned at the beginning of the webinar, all our panelists are also college academic mentors. So please feel free to reconnect, to set up appointments with them, to ask follow-up questions. And just before we part, I just want to ask you, what would be the one advice that you would give to our attendees that you think you would like to know when you started out on your career? Anyone?
I'd say take your time. I feel like it's easy to, or at least undergrad, my senior year, a lot of people around me were very sure of what they wanted to pursue, and they were all like, well, a lot of them were applying to graduate school and all these other programs, and it at least made me feel like, oh, should I be knowing this so soon? And grad school is a big commitment, as you can see, like financially. Sorry if I made it sound like it's easy to find funding. It's not. But it's not. It's very expensive. It's like, it's an investment. So just really making sure that it is a genuine interest of yours. And yeah, it's okay if you take a little longer.
Yeah, I do want to follow off that. You don't need to have everything figured out right now, especially, right after college. There's still a lot for you to learn. And so to kind of share something that my preceptor shared with me during my internship is, kind of take advantage of this time that you have while you're, generally young. You have 40 years ahead of you to work. That's a lot of time. So why not take a year or two to kind of learn what you want to do and to get involved in? It can even be like 5 years, 10 years. You just have so much time ahead of you. So there's not necessarily a rush to have everything figured out.
Something that I would like to say is, on top of what everyone else has been saying, which is absolutely true, take advantage of the programs and panels that are put on by the various entities of the school. That those programs are where you can have the most unexpected learning and some of the most wonderful experiences that are wholly unique to college. And you can also meet people by having fun. Like, let yourself have fun as a student, because I know it can be very much like, I have to perform well in class, I have to do well. Having those skills when you graduate for self-care and knowing how to budget in that self-care and fun can make it so when you're in graduate school or in a career, you have that established like time management skill, and you'll end up being a lot better just mentally.
So for me, it's like instead of always focusing on the ranks of universities, maybe we should pay more attention to which programs actually suits us best in terms of academic goals and finance.
And then for me, just kind of on the themes of networking, I would say as students, you guys are in a really unique place to reach out to folks that are out, in practice that if you want to learn more about what they do. And so if, let's say you're curious about like, oh, what is it like being an epidemiologist? Feel free to use resources like LinkedIn and reach out to somebody there and say like, hey, my name is this and I'm an undergrad student at UCLA. I'm interested in learning more about this. Would you mind speaking with me for just a few minutes to talk to me more about what you do? And that's a great way for you guys to just kind of get to know like maybe other people's career trajectory or what they even do on a daily basis. Because sometimes I remember I had this problem when I was an undergrad, right? Like sometimes I'll think that a career is one thing, but then when you really get to know what they actually do on a daily basis, it kind of changes. And so I would, recommend you guys explore as much as possible, whether that's shadowing, informational interviews. Like my peers have said here, you have a lot of time and resources in front of you, so don't, be afraid to use them all.
Anyone else? Everybody went? Awesome. Well, thank you so much for your time and participation. Thank you for the attendees to taking the time to spend this hour with us. I hope the information I shared, our panelists shared, it's helpful in your career journey. Please feel free to make appointments with the Career Center and with the College Academic Mentors. We are here to help you. And again, just thank you, and have a wonderful weekend, everyone. Thank you so much.
Thank you.
Thank you.